Welcome to the American Academy of Grief Counseling's Videogram on grief, counseling, and suicide. And in this video, we're going to look at counseling those who are contemplating suicide and then speaking to others who are family members who have to deal with the aftermath of a successful suicide itself. So suicide, if ever, is rarely a free choice, one that a person of healthy mind wants to do. It's usually a result of mental anguish or a type of mental sickness that is so strong it overwhelms the individual. Are there any particular ones that could be consciously decided? It's possible in some societies in the Far East where honor is held above certain things, probably too highly. But for the most part, suicide is something that is a result of a sickness, and the individual needs to be respected and mourned properly. In the past, it was known within the Western world as the sin of despair, or in Christian circles, the sin of Judas, because Judas hung himself after betraying Jesus Christ. So today, we tend to see it more as an illness and so forth. And within the Catholic Church alone, individuals who have committed a suicide are granted a Christian burial because no one knows what the final thoughts were in their head. And it's obvious that these individuals were suffering from a deep anguish, and they were not in their right mind. And I think that is an important change of policy within many circles, where suicide, the individual who commits suicide successfully is considered a victim, him or herself. And that's extremely important. But still, within society itself, stigma of suicide is very strong, and a lot of families try to hide it. They're embarrassed about it and so forth, and it can cause various implications within their own grief recovery. Some stats: 25% of the population has considered or thought of suicide at one time. 75% of those who try to commit suicide are successful the first try, which is why it's so important to prevent anyone from doing it. Men are more likely to commit suicide than women, and suicide also runs within families and friends. So these are some warning signs to look for. Suicide is also closely correlated with depression. That's why it's important to do an assessment of depression when dealing with individuals who are grieving for an extended period of time. A lot of times professionals will ask, what is the scale of your sadness between 1 to 5? Other thing to look for is sadness over an extended period of time. How long have you been sad? Usually 2 weeks is the limit where an individual, if they're experiencing extreme sadness, individuals start to need to be monitored a little bit more. And within that 2 weeks of intense sadness, is there a loss of interest in activity? Is that individual displaying a lack of energy, a loss of confidence, feelings of extreme guilt, difficulties concentrating? So all of these are important in deciphering whether or not a person is not only depressed, but if they're potentially thinking about suicide. Remember that with suicide, there is a high level of hopelessness. And this is what leads many to their only other escape, which is to escape from life itself. So suicide assessments are important, not just for licensed professional counselors and nurse practitioners who work in these fields, and psychiatrists and so forth, but also for basic certified grief counselors who may not be licensed professionals in the area of counseling. So doing a suicide assessment is sometimes a very important thing to work with a client or a patient and to go over a few things with them regarding it. So assessing the lethality of the person's plan is important. What is the person's intent? What are the means of carrying out this particular intent as well? Is there an identifiable plan? And is there a timetable with that plan? And how frequent and intense are these thoughts of carrying this plan out? Is the plan able to be carried out? Is it within the person's means? And are the weapons necessary available for it? Does the person own a gun? Has he idolized using a gun? Or has he thought about hanging himself and so forth? Or is it going to be due to a drug overdose, a purpose overdose with heroin or cocaine or something like that, or even just aspirin? Is there a identifiable plan? Are they able to do it, and so forth? And how do you feel listening to this in regards to that plan itself? Uh, is there a high probability that the individual will do this, and are they able to do it? So in these reactions, when you do a suicide assessment and you determine if the plan is identifiable, is there a timetable, is it able to be done, has it been thought about a lot, you then begin to look at low risk versus high risk individuals. And this is where you need to be really good at your craft in knowing who is more low risk and who is more high risk, because it can come back really to haunt you if someone who was high risk isn't giving the attention they need. And that's why it's usually safer to err on the side of caution in regards to calling the proper authorities, the police, admitting someone, or having family admit someone into a hospital for evaluation. But before that, usually if it's low risk, you look for family intervention and additional counseling to help these individuals. But if you see a real high risk probability in it, and when looking back at that suicide assessment and lethality, that's when you start taking a more direct approach with intervention, especially with utilizing the help of the police or admitting someone into the hospital. I think one of the biggest things you can get out of an individual who's having suicidal ideation is a no suicide contract, where they agree that, yes, if I begin to feel hopeless, if I begin to feel really bad about myself, I will not do anything unless I at least contact you first and talk about it. And that can be a lifesaver in stopping someone from killing themselves and getting the help they need before they're able to carry out a potential doable plan and so forth. Now, that's the first aspect of suicide, dealing with someone who is contemplating it and identifying high versus low risk, seeing how lethal a plan is and how to react to it. But there's also helping individuals, family members who lose a loved one through suicide itself. And this is where crisis intervention comes into play again, and grief counseling and crisis intervention when we're discussing suicide and successful suicide and so forth. This is where they come together. So obviously a person who is thinking or contemplating suicide is in a state of crisis, but so is the family when they discover that an individual has committed suicide that they love. So the family is in a state of crisis, and individuals who are on the scene or counselors who might help later, their job is to de-escalate this crisis state and help the family find in an emotional pre-crisis state where they can think more logical, and they can find more peace in that they're not running wild with thoughts that aren't connected at all. So that's what crisis does. And it makes people do things they would normally not do. And it's important to help family members regain some sort of calm so that they can rationally think. So it's important there then for, if you're there, to identify any danger signs or any dangerous emotional reactions to this. You want to, as in any case of crisis, you want to listen, emphasize, and you also want to debrief. You want them to talk back to you and tell you what their feelings are and what they plan on doing. Following this, there's other stages, funeral and later counseling sessions where there's family support and follow-ups, suicide support groups, and so forth. But individuals who lose a loved one through suicide can also be at risk for suicide and also become candidates for a more complicated type of grief because they're not able to recover the way a normal person would recover through a loss, just because of the severe trauma, the unexpected loss, and the disenfranchised nature of the loss itself. Many family members who are going through a successful suicide, some will feel guilt. Maybe they feel they didn't do enough for that person, or they should have seen it coming. Some are angry. They're angry at themselves or another family member because they don't feel they helped the individual, or that they could very well be very angry at the individual for killing themselves. And they need to be explained that the individual family member who killed themselves didn't do it to hurt anybody else, but they did it because they themselves were hurting so bad emotionally that it was that they were unable really to think clearly or logically itself. Some family members will feel betrayal, others will feel shame and fear because of the disenfranchised nature of it. Grief counselors and crisis intervention counselors really need to help these individuals cope with what occurred. Many come from strong religious traditions, and they might feel that their loved one is in hell. And these types of things need to be dismissed. And also, there needs to be a reframing of what occurred to understand what occurred, that it's not their fault, it's not the person's fault, that God loves everyone, and that you need to cope properly with this type of traumatic loss. It's not a simple solution. Also, we have a few others listed here that you can help individuals with. Power, being more powerful in what they want to do than being a victim. A lot of them feel like they're a victim of their family member killing themselves, and there's a stigma that goes with it. But instead, take power over that victimization and to understand what occurred and how you are not at fault for it, and so forth. Also, another important aspect is to help the individual find new meaning in survival and purpose, despite the fact that their loved one killed themselves. This is common in grief counseling, in rewriting your story, seeing where the past fits, but not allowing it to dominate your future, but still allowing it to play an integrative part in who you are now and where you will go later. And finally, issues of resentment and forgiveness counseling can help with. So you don't resent the individual and you're able to forgive them for what they did and understand why they did it, and to have some sympathy in that. So there are many raw emotions that exist within the family after a successful suicide, and grief counselors and crisis intervention counselors can help get to the bottom of it through identifying these emotions, but also helping individuals cope to become more powerful and not a victim, understanding how the suicide is a story in their life, and then also how to move on from resentment and forgiveness itself. If you'd like to learn more about grief counseling or even crisis intervention counseling, we do offer programs in both these fields. For the American Academy of Grief Counseling, we offer a certification program. It has online and independent courses that you can take. Upon completion of those 4 courses, you can then earn a 4-year certification in grief counseling itself. Here is a link to our grief counseling program, as well as a request for information form. Our contact information is 330-652-7776. Again, that phone number is 330-652-7776. And our email is info@aihcp.org. Again, that's info@aihcp.org. With that said, suicide is something that is very tragic, and it's something that sometimes cannot be controlled. The individual is led to such a level of hopelessness and despair that it seems to be the only thing they can do. So as counselors, we try to identify the high-risk suicides, do an assessment, and we also try to help families who are victims of that type of of that type of death and help them to understand why maybe the individual committed suicide and so forth. It's a very sad topic, unfortunately, and it occurs too much. I'd like to thank you for listening today, and I hope you have a great day.